Lifetime risk for women is that they have a 1 in 8 chance of developing breast cancer. Currently, the American College of Radiology recommends screening mammography once a year for women starting at age 40. And what that allows us to do is to evaluate the breast. It gives us the big picture view of the breast. Also helps us see small microcalcifications that can be a sign of stage 0 breast cancer. That's when we really want to catch a breast cancer because it's the earliest we can possibly see it. When you come in for your first mammogram, you'll be walking up to the front desk and be greeted.
Hi, you're here for your 9:30 appointment. What's your last name?
We'll get you checked in, and then if this is your very first mammogram, we're going to give you a short history form.
Come on back. My name's Kendra. I'm going to do your exam today.
The technologist will come and get you from the lobby, bring you back to the exam room.
How are you doing today?
It's just so easy. It normally takes less than 20 minutes.
We're going to come right into this room here.
This is a really convenient, completely non-invasive way of screening for one of the most common types of cancer in women.
Perfect. So then I'm going to have you, do you have any deodorant on today? No? Good. Okay. So then,
if you have any deodorants or powders on, we tell you to wipe that off too so it doesn't show up on the mammogram.
And tie in the front. And this is first mammogram for you today, correct? All right, so we'll talk you through the whole thing. Just go ahead, take top and bra off. This gown will open and tie in the front, kind of like a robe. Once you're all ready, come on in. We'll get going, okay?
Once you have changed, we will bring you into the exam room itself and explain the procedure to you.
We will do roughly 4 or so pictures. With regards to compression, we basically compress until the breast feels firm throughout. The more you compress, the better image that you're going to get, but obviously we're not trying to hurt anybody, so just kind of let me know and we'll kind of communicate throughout.
When you have completed your first mammogram, it is extremely common to get called back for additional views. Mammography is all about looking at tissue changes through time. If it's your first mammogram, we don't know what you looked like last year or the year before that. It does not necessarily mean that anything is abnormal, but they want to figure out what is normal for you since it's the first time that we have imaged you.
So kind of as I'm taking my fist here, you see the paddle will come down. I may do a couple extra cranks down.
The compression of your breast is not supposed to make your eyes pop out of your head, so it's supposed to be tight, but not so tight that we're causing pain during this.
Your arms by your sides. I'm basically just gonna lift your breasts and I'm gonna bring this up to height. And then I'll have you look towards me and lean in. So lean in here. And then you're perfectly good. I'm gonna make sure I've got everything on the lateral side. I'll give you a little hug. Bring this compression down. Just about like that. You doing okay? Down like that. Real still. I'm gonna go back and do the exposure.
Once that pressure is on your breast, we go back behind the control panel to start the exposure.
Take a breath in. Hold your breath. You can breathe and take a step back.
Once the exposure is complete, that pressure releases automatically from your breast.
Lean in here. I'm gonna make sure everything's in on this side.
For a screening mammogram, we generally do 4 views, 2 images of each breast. One goes side to side, one goes top to bottom.
We'll have you bring arms straight up, and we'll kind of come to the side here.
Well, I think that screening mammography has a bad reputation in terms of pain and discomfort. But if you come in, most of our patients say, that was not as bad as I thought it was going to be. There is some firm pressure on your breast. It's just for a few seconds, and most patients say that no, it was nothing like they thought it was going to be, and it was a whole lot easier than they thought. A big part of screening mammography is the philosophy of early detection, that we want to catch something earlier rather than later because it's easier to treat. You don't need an order from your doctor so long as you're not having any new problems. For a screening mammogram, you can be a self-referral, or you can just walk in and say, I'd like to have a screening mammogram, so long as it's been a year since your previous mammogram.
The report will be mailed to you. It'll go on to my chart. If we need anything additional from you, our girls in the back would call you to schedule. Do you have any questions for me at all?